Three caregivers bring their children to the health facility for a visit. All three have children who are due for vaccination. The first caregiver brings her child for a well visit. She has lost her child's home-based record, so the health workers say they cannot screen vaccination status. The second caregiver has come because her child is injured and does not know to ask to have the child screened for vaccination. The third caregiver brings her child with a cough and mild fever but does not ask about her child's vaccination status. She does not know it is safe to receive a vaccine with a mild illness. Unfortunately, all three children leave without receiving the vaccines that are due. These children are examples of missed opportunities for vaccination, or MOV. MOV can happen for different reasons, but as you just saw, caregiver behaviors can also play a part. There are ways to address these gaps in caregiver behaviors and reduce MOV. Remember, MOV refers to any time a person who is eligible for vaccination visits a health facility but does not receive all the vaccine doses they are due. The person may be eligible for vaccination if they are unvaccinated, partially vaccinated or not up to date, and free of contraindications to vaccination. Missed opportunities refer to both children and adults, especially women of reproductive age. A key strategy to reduce MOV is to screen and vaccinate all children who are missing vaccinations, and this in part relies on informed and prepared caregivers. In this video, we will look at interventions to address the most common caregiver behaviors that lead to MOV. Caregivers do not keep or bring home-based records to every health facility visit. They are not aware what vaccines their child is due and do not ask about screening during non-vaccination visits. And they are hesitant about vaccination. Often, this is related to concerns about contraindications, adverse events following immunization, or receiving multiple vaccines at once. First, how can you encourage caregivers to keep and bring home-based records? Consider job aids for both caregivers and health workers. For example, use posters to remind caregivers to bring home-based records to every visit, or to remind health workers to discuss the importance of home-based records with caregivers. Conduct health talks with caregivers about the importance of owning a home-based record and bringing it to every health facility visit. But make sure health workers know what to do when caregivers do not bring home-based records. Provide training and job aids to promote best practices on missing records. All health workers should know to never deny vaccination because of a lack of a home-based record, how to use the register to screen for vaccination status, how to issue a new or temporary home-based record, and how to counsel the caregiver about the importance of home-based records. Next, how can you raise caregiver awareness about the vaccination schedule and screening during non-vaccination visits? Look for opportunities to communicate with caregivers about the vaccine schedule through health talks and community outreach. In some cases, caregivers do not know that more than one dose is needed for some vaccines. Vaccination stickers such as this one can help them remember the schedule. To raise awareness about screening, give caregivers reminder cards. They can show these cards to providers at any health facility visit. Provide job aids to remind health workers to screen vaccination status of each child, such as this poster with the vaccination schedule. One strategy is to set up a screening area in a central area or near the health facility entrance. Have staff place an alert sticker on any home-based records of children due vaccination. They should explain the sticker to the caregiver and refer them to the vaccination area. Next, consider ways to address vaccine hesitancy among caregivers. Some caregivers may have concerns about contraindications, especially if they have brought children for a sick visit. To address their concerns, display job aids such as a tabletop card or poster listing true and false contraindications. Caregivers may also have concerns about adverse events following immunization or about receiving multiple vaccines at once. Train health workers to address each of these concerns using key messages about the importance of vaccination, eligibility, and safety. Now, you should be familiar with some interventions to address common caregiver behaviors that lead to MOV.